Hi, my name is Augustine Pale. I'm a student of Utah Tech University, and I have a presentation, community and public health presentation, and this is my state ID. I am going to be presenting on the topic, the prevalence of illicit substance use amongst West Valley youth. The West Valley youths have been noted to be strongly involved in the use of illicit substances, specifically marijuana. And I have had the burden to see how we can contribute in curbing this condition or trying to prevent this condition from happening completely. So community assessment presentation, nursing 4020, the illicit drug use of West Valley youth and young adults. The West Valley community youth was assessed for the increase in the use of illicit drugs among the community youths. And I specifically narrowed my focus to the African American community that I have a very great access to, and those that live around the West Valley community and its environs. I interviewed parents of the community. I also interviewed community leaders, religious leaders, and one of the youth leaders of the community. And here are some of the reasons they say were the causes of the youth getting involved so much into the smoking of marijuana. Some parents say it's due to the act of witchcraft, some family members wanting them not to succeed or their children to succeed. And as I interview community leaders, they say it's due to poor parenting. And the community youth leader that I interviewed said that it's due to what he called societal approval or peer pressure. And as a result, I see this as a very serious public and community health concern, which require community intervention or public health intervention. The troublesome problem is what I have been alluding to. The problem is the rate and level of involvement of the community youth in marijuana use. It is noted that about 80 to 90% of the community youth are all involved with marijuana use, which has the potential to lead to the use of other higher substances of abuse. My community diagnosis is the prevalence of drug abuse among African American youth in West Valley City, as related to peer pressure, as evidenced by many African American youth in jail and prison for drug-related crimes. The goal of this project is to derive a solution that will prevent, mitigate, and treat the plight of drug abuse, which is devastating the lives of the youth of our community, the West Valley community. Healthy People 2030 objectives, Healthy People 2030 objective for the nation indicates that a collaborative effort of healthcare organizations and pharmaceutical organizations to educate the public on the misuse of opioids and other illicit substances will achieve some of the goals of substance abuse. That means it takes education, which confirm our goal for solving this problem. Interventions. Some of the interventions we decided to come up with, finding an amicable resolution to the marijuana use of this and substance abuse of the West Valley community youth require the following intervention. One, a robust drug prevention program. We have started a robust education on drug and substance abuse. And 2, 3, peer pressure education, and then what we call the better way forward, which includes teaching from the Bible and youth learning how to pray and other sporting activities. And there were some pictures that show where we had a program, and after the program the youth had some meals, because we have to attract the youth to bring them to the program through finding some meals after the teachings. And this ends my presentation, and I want to say thank you for listening, all of you, those of you in the audience for listening, and those of you who are watching me. I want to say very thank you to my professor, my instructor. I say thank you and thanks.